Within the field of orthodontics, high-quality clinical photographs are essential for many reasons. Photographs are used as an important diagnostic tool where they are used to diagnose malocclusions and confirm treatment plans. Along the orthodontic treatment journey, photographs are also taken to monitor treatment progress and also allow clinicians the chance to custom treatment approach based on these records. Apart from these main points, photographs are also presented as an aid during patient education, allowing the patients to relate to their teeth situation, treatment options, and possible treatment outcomes. Excellent photographs also serves as an important legal recordings and may be needed to assist medico-legal proceedings should the need arises. The current gold standard camera equipment is the digital single lens reflex, or more popularly known as DSLR. DSLR has been recommended and recognized for its ability to produce better image quality and better control in the camera setting. However, the disadvantages with using DSLR are its bigger and heavier in size, higher in price, and the skills required to operate it. The alternatives to DSLR are mirrorless camera and smartphones. Previously, mirrorless camera and smartphones have poorer image due to its smaller sensor size. Thanks to evolutionary advancement in sensor technology and image processing, the clinical images produced by these alternatives are comparable to DSLR as reported by Shahrol in 2021. The objective of this study is to develop a novel set of standard operating protocol using a mirrorless camera and smartphone to record orthodontic clinical photographs. The camera settings recommended are listed here. The example of mirrorless camera and smartphone described in this study are from Canon and Apple. The extraoral photos are taken with the patient in a natural head position, and an LED light box is used as a background to reduce shadow in the image. The intraoral protocol requires cheek retractors, intraoral mirrors, and a light source. The light source for the mirrorless camera is similar to the DSLR ring flash, whereas the smartphone uses a twin flash from LampU. Here are examples of photographs that was taken using mirrorless camera and smartphone camera. On the top row, the images are the result of using mirrorless camera, whereas the bottom row was taken with a smartphone camera. This study adds value to our clinical practice by establishing guidelines in using mirrorless and smartphone cameras to produce good quality images. Currently, there is no study that has been conducted using mirrorless and smartphone cameras for clinical photography purposes. Majority of population owns a smartphone, as smartphones are considered as an essential item nowadays. It is also not uncommon for people to own mirrorless cameras too. Because of these alternatives cameras are readily available, smartphones and mirrorless cameras are practical and cost-effective in taking clinical photographs. The LED light box and LampU adds value by enhancing the image quality that is produced. This setup reduces the cost of having to own a DSLR camera to capture excellent orthodontic clinical photographs.